Unique People Services, also known as UPS, is a nonprofit organization, and our mission is to serve holistically and without judgment individuals with special needs. We provide services to people living with HIV and AIDS and their families, people with a mental illness and a history of homelessness, and people with developmental disabilities. And we provide housing along with comprehensive support services, which include substance abuse counseling, case management, mental health counseling. And our housing ranges from transitional housing to permanent housing. We have over 250 apartments in the Bronx, Manhattan, and Queens. We also have congregate care, and we provide an array of services in between that so that people could live more independent lives. Unique People Services' strengths lie in the fact that when we have been in existence for over 20 years, and in that 20 years we have maintained a lot of our staff. We have a lot of staff that have been with us between 10 and 15 years, and some since inception. We promote from within, which we're very proud of, and we invest in our staff. We make sure that they have the skills needed in order to provide quality services, as excellence is one of Unique's values. We also are very proud of the fact that we do really well in our audits. A lot of staff put in their hard work and time to make sure that quality services are provided to our individuals. So I think that Unique has a lot to offer. In 10 years, I think Unique would like to be a household name. We'd like to be known out in the community as an organization that provides quality services to people with special needs. We'd also like to see ourselves being partnered strategically with a large, well-known, for-profit organization. We feel that they could give to us services that we can't pay for with government funding, like fundraising and marketing, and we could give to them a fulfillment of their social responsibility. We'd also definitely like to be major players in the new service modalities that are coming out for our sector, and we definitely want to be a strong player in that. I think the incidents that have come up in the New York Times have been tragic. There has to be a zero tolerance for abuse. No one supports that at all. However, I think that the perspective that's been given on it is skewed in the sense that they're only talking about the negative things that happen. We serve over 100,000 people within the human services. We have over 700 agencies like Unique People Services that provide services to people with developmental disabilities. So to only talk about the negative things, I think, is unfortunate, and the perspective is definitely not the perspective that should be put out there. There needs to be more positive talk about the good things that are being done in the industry, that many organizations do incredible work. There are many success stories. There are many families that are so grateful to what the agencies are doing for supporting individuals living quality lives. So I really feel like the perspective has been off. The economy has definitely been difficult on Unique. We have experienced personally anywhere between 3 to 18% cuts within our funding, and that's a major amount. We've had to restructure programs, we've had to let individuals go, we've had to not fill positions, and that's a challenge because we continue to have high levels of accountability, more regulations put on us. So there are a lot of things that we're doing, continue to do, and just providing quality services with less money is always difficult, and that's a major challenge. I think the other challenge is securing diverse funding. We are a 100% governmental funded agency, and we really need to get out and have more philanthropic support, reach out to more foundations, getting grants, so that we have other options to fill the gaps that the government fundings are now no longer able to provide. I think the biggest surprise is how managed care has become so much a part of our lives today. A couple of years ago, managed care, our population was carved out for the most part. But now managed care is the way to go, and the government has rapidly changed and is changing the way we provide services to individuals, whether it's the 1115 waiver that's coming in for people living with developmental disabilities, or it's the health homes that are being developed for the mentally ill and for people living with HIV. These are all new entities that have come very quickly, and we are changing very quickly with it. So I'm really surprised at how fast the government has engaged in this new structural change for our modalities. Unique would like to be able to have a better public presence. We definitely want to be out there for people to know who we are, know what we're doing, know what we're about, know that we provide quality services. And we'd also like to be linked with a large organization that we'd be able to do some of the things that I talked about in terms of getting out there, marketing, fundraising, some of the things that government funding doesn't support. And we have a new project coming out where we want to do mixed-use housing for people with low income as well as individuals living with a mental illness, and to see that project come to fruition in 2012 would be a great accomplishment for us. I really feel like there needs to be more reports put out that talk about the positive things that human services like Unique People Services and other organizations do. I think that the public needs to know that there's a lot of positive things within our industry, that we do a lot of good things, and that it's not just about abuse and neglect. Bad things happen and you do have to address them, but a lot of good things happen as well, and that message is not put out there at all.